Today, I will take you through the process of a good visit to your doctor so you do not fall through the cracks. Let's look at a good example of how to approach your doctor.
So how have you been feeling?
Still the same. Fine, going to the bathroom a lot. Feel very tired, lethargic.
Okay, well, so we have all the results back from the tests we did during your physical, and that's what we're going to go over today. So here are your blood glucose levels over the past 3 to 4 years. They were 5.0, then 5.5, and then 6.2. So you can see they're slowly on the rise. These readings indicate pre-diabetes, which means that your blood sugar level is between 6 and 7. Now, I know we only have a 15-minute appointment today, but it's really important that you understand what these readings mean for your health. My primary goal is to get your blood sugar back to a healthy range, which is between 4 and 6. Now, I'm going to prescribe some lifestyle changes to help decrease your blood sugar, which include exercise, healthy eating, and sleep.
The first thing your doctor will want to do is to make sure that you understand your results properly. Prediabetes is a condition when blood sugars are higher than normal, but not high enough for you to have a diagnosis of type 2 diabetes. Although not everyone with prediabetes will develop type 2 diabetes, many people will. It is important to know if you have prediabetes because research has shown that long-term complications associated with type 2 diabetes, such as heart disease and nerve damage, may occur during prediabetes.
So here's a fact sheet on type 2 diabetes by Women's Health and Women's Hands. Now you see your blood sugar is 6.8.
So I have sugar? I'm almost diabetic.
Well, fasting blood sugar is only part of the picture. Right now, we just know that you have pre-diabetes. I want to calculate your hip to waist ratio. Do you mind standing for a bit? And do you mind writing down the numbers as I take the measurements? Thank you. $49. 55. Okay. Now do the calculation. So your waist to hip ratio and BMI are the upper limits, and you have abdominal obesity. Now research shows us that abdominal obesity puts you at increased risk for heart disease, heart attack, hypertension, and stroke. So we want you to eat healthier and eat the right portions of good quality food, in terms of when you eat, what you eat, and how much you eat. So are you interested in getting some additional support?
Absolutely.
So I need your consent to fax a referral to Women's Health and Women's Hands Diabetes Education Center. They have holistic professionals with expertise in diabetes, managing signs and symptoms, diet, and exercise that are all culturally appropriate.
Sure, I want to be able to start right away.
Okay, just one more thing. When we went over reproductive health, you mentioned that you and your partner were considering having a child. Now, I really want to get your prediabetes well managed and even turned around before you conceive. This will decrease your chance of getting gestational diabetes. And before we head back to reception, I just wanted to suggest that you have the rest of your family look at their risk factors for type 2 diabetes.
Okay, thank you.
And we should have you booked for follow-up within 6 to 8 weeks after you've gotten settled in at the Diabetes Education Center.
Now, that was a great example of high-quality healthcare educational exchange about diabetes care. And here is why. First of all, the physician provided important facts regarding the client's health, such as waist to hip ratio, BMI, and fasting plasma glucose readings. Secondly, the physician also explained what prediabetes means and why abdominal obesity leads to other health issues such as heart disease, heart attacks, stroke, and hypertension. Thirdly, the doctor also remembers about her client's family planning and provided her with good information on how to lower her risk of gestational diabetes. Fourthly, the doctor encouraged her to check in with her family about their level of risk or vulnerability to diabetes. Fifthly, the doctor engaged the client. The client participated in acquiring their measurements. Also, very quickly move the client on to the next steps by arranging for the client to go to a diabetes education center, lowering the chances that they would fall through the cracks. If your BMI, waist to hip ratio, fasting blood glucose is at the top range or above the recommended range, you can refer yourself to Women's Health in Women's Hands Diabetes Educational Center. For more information, go to whiwh.com.